Hey everybody, it's Dr. Tyler at Sioux Center Chiropractic, and today I have Carson with us. She's our new chiropractic intern, so she's helping treat patients in our office and examine patients, and she'll be graduating chiropractic school later this spring. So we're excited to have her on board. Our patients have been happy to have her helping out, and today we're going to do an adjustment on Carson. And Carson, why don't you tell us a little bit about what's going on?
Yeah, so I have some hip pain that kind of comes and goes, more on the left. And then my wrists occasionally bother me. I just started playing like a volleyball league, so they're bothering me a little bit more now. And then the upper back, I'm starting to study for my last boards too, so
Yeah.
it's getting a little.
So she's got her head down on the computer or the books, getting ready to knock those last parts of the chiropractic boards. So cool. Well, we've been working on Carson here for the last several weeks, and I'm just going to go through a video of how we're going to treat her today. So we'll start with our assessment. I'm going to have you just stand here, Carson, and then with your feet together, go ahead and face me just a little bit more, and then look up and down with your head and neck. And you just go through these, tell me if you have any stiffness or pain, and then go ahead and face her, and then, yep, we'll rotate. Any pain with those?
A little stiff in the upper back.
A little stiff. Go ahead and face this way, feet together. And then we'll check your shoulder mobility. Go ahead and reach overhead with your right arm, touch left shoulder, and then do the other arm. Good. She's got a little bit of winging going on here in the scapula. Winging of the shoulder blade just means that the shoulder blade is lifting off of the rib cage more. Flaring would be when it's coming up this way. So she's definitely got some winging going on there. We see that quite often with overhead athletes as she's a volleyball player. So we've been working through some of that with her. Carson, go ahead and reach underneath each way now. There you go. And it's even more prominent with internal shoulder rotation. And you can see that baby wing out even more. You can see the whole border of that shoulder blade. All right, and then we're going to check thoracic or multi-segmental rotation. Go ahead and turn to the right as far as you can. That's not bad. And then to your left. Okay, good. Carson, I'm going to have you face this way, and then we'll go arms overhead. And then I want you to look up at your hands, and you're going to arch back. We're going to check extension. So she's extending mostly here, pretty flat through the thoracics. Come back up. And then we'll do flexion by having you bend forward and try to touch your toes. A little flatness in that lower back. Come back up. All right, and then just step backwards a little bit more, and we're going to check your squat pattern. Go ahead, all the way down. Good. One more. Good. Any pain with those? Not bad? Great. Okay, let's go ahead and we'll sit here. I'm going to do some motion palpation on Carson, starting in the hips, working our way up, and see where we need to focus our adjustments today. How many weeks do you have until part 4 national boards?
It's November 11th, so about a little over 3, I think.
Last one. And she's going to knock it out of the park. She's been doing a good job getting lots of practice here in the office, and a little sore as I got right into there.
Yeah.
I'm feeling more restriction at the L4, L5 region on her, a little bit on the both SI joints actually. And then as we get up into her thoracics, you could see when she was arching backwards, all that extension was happening down here. So she's really limited in the middle thoracic spine. Go ahead and bring your hands behind your head, elbows together, and I'm going to lean you forward, and then feel that even more through here. And relax. She's actually got decent mobility as we get up into the upper part of the thoracic spine. And then we'll check her lower neck. A little tender there. Yeah. On that left. So about C2 through C4 on the left are limited with extension and rotation. So we'll get those adjusted. I'm going to check your hip with you on your back, and we're just going to check that mobility. So left hip was the culprit on her, so we're just going to bring that up and check a couple different planes of motion. So flexion, any discomfort there?
No.
Internal. internal range of motion or internal rotation has been kind of the hot spot on her. So check it there, and then I'm going to bring her into adduction. And does that pinch at all, or is it more when I'm up here?
More when you're flexing it.
So flexion and internal rotation sets that off a little bit. We'll check external rotation. I'm going to push down on your knee, and I'll push on your hip if that's okay. And we'll go here. Any pain with that?
No.
Not bad. Okay, we're just going to check the other side quick for good measure. Anything there?
Yeah.
A little pinchy there
Yeah.
too. How about there?
A little bit, but the other one's still worse. It's like the same as the other side.
Okay, and then we'll check here. Anything with that? Not bad. Okay, let's go on your stomach. We'll check it hip extension quick, and then we'll get started with the adjusting, and then we'll get to the wrist. All right, so we'll check left hip extension. Tell me if you have any pain with that. Anything?
Nope.
Good. And then right. Not bad mobility and extension. Pretty good here too. Awesome. Great. All right. Let's start. We're going to go through and adjust her first. So I'm going to have her lay on her side facing me, Carson, and we'll take care of that lumbo-pelvic region, and then we'll get you on your back, get your mid-back, and then we'll get your, while you're on your back, get your hips too. Okay. So we're going to be right here, and you just relax. I'm going to lower the table a little bit more. There we go. All right, I got you. And just take a deep breath, let it out. Nice. Other way. That feel all right?
Yep.
Then we'll go this knee up, slide towards me. You got it. Perfect. Right here. Just like that. All right, deep breath, let it go. Not much audible. Right here. Let it go. Okay, on your back. Grab my hand, Carson, and lay back down. And then we'll go arm over arm. Take a deep breath and let it out all the way. Last one. Good. Back up. And on your back one more time. All right, we're going to set the drop here. You're just going to feel the table come up and just let your head go back. Any pinchy there?
Nope.
Okay, good. Go here, little drop. One more. Good. Okay, with the other side. That pinch.
Just starting to almost. Not there.
Good. Is that
A little better.
a little better?
Yeah,
Then
it's a little pinchy.
go this side.
It's better.
Yeah. I'm going to just do a little distraction on it this time. So go ahead and hold the side of the table and just let that relax. Good. Feel that?
Yeah, I felt that.
And then we'll do this one. Same thing. Good. Great. All right. Then we'll get your neck.
Okay.
All right. Very common to have neck, upper cervical or upper neck joint restriction, muscle tightness, especially when you're studying or looking at a computer often. And I'm just going to do a little active stretching over this upper part of the neck. A little tight.
Yeah.
Around the suboccipital muscles, which as your head goes forward over the spine more and more, the weight of your head to the rest of your body increases, not literally, but I always say picture holding a bowling ball in one hand, and if you continue to try to straighten your arm out while holding that bowling ball, you feel all the tension in those muscles of your forearm. And that's kind of what's going on in the muscles of your neck and upper back when that head leans more and more forward. So we're constantly working with patients on getting them to be able to stabilize the shoulder blades and the mid back region so that that head can pull over the spine and just take a lot of that stress off the joints. All right, that should be ready to adjust here. Relax. Good. Okay?
Yep.
Right through here. Awesome. All right, Carson, go ahead and sit up. So, a lot of the tension kind of coming into the outside of the wrist on you, and you've noticed it more like in those push-up positions.
Yep, and I have my weight on it.
Right. Not unusual. As chiropractors in training, we'll see, we'll definitely see some wrist tension and restriction just because the more reps you're getting, your body's not quite used to it yet. So, constantly working on strengthening the wrists, because we use our wrists quite a bit in this profession. Yep. Okay, so I'm just going to stretch this muscle first. Okay.
Mm-hmm.
Feel that?
That one, yeah.
And I'm going to be right in here.
Okay.
And I'm just going to be on this ligament. Start closing it down. Tension there. Tell me if it's too much.
No, that's good.
Did feel like a good hurt.
Yeah. Stretch right now.
Good. All right. And I'm just feeling how those wrist bones are sliding next to each other. There's a lot of little bones in the wrist, and the wrist needs to be mobile. It's the wrist and ankle are very mobile joints. They do better when they have mobility, and when they don't, we'll start making up for it elsewhere, usually up or downstream. So just got a little restriction in the bone called the lunate here in the middle of the wrist, so I'm going to go ahead and adjust that. And you just let that elbow relax. I got you. Let it go. Already feel it. A little more. Good. That okay?
Yeah.
Right, try to move that around. How's that feel? Okay?
Yeah.
All right, let's check this side. And this one hasn't been quite as bad on you.
No, not usually. I had a little episode about a week ago.
About a week ago.
Better.
Just got a little bit there too, but we'll go ahead and work this thenar area on her by just opening and closing and stretching that. How many sets of volleyball did you guys play the other night?
4.
4?
Yep.
Carson was a college volleyball player, and
But not for like 3 years.
she's been on retired for the last 3 years, so coming out of retirement, shaking off the cobwebs on the volleyball court. It's good to get back out there. We definitely see a lot of upper extremity complaints in our volleyball population. Just wrist can be one. I'd say shoulder is probably the most common thing we'll see, and anything shoulder is definitely going to impact the neck and upper back, middle back region. So that's something we're always addressing with most of our overhead athletes, but this time of year, volleyball in particular. There. All right, little lunate here. Okay. All right, move those around.
Yeah.
And then push into me. How's that feel?
Good.
Good. All right, well, thank you for watching our treatment today, and got Carson all tuned up, so she's ready to continue to serve our patients. And yeah, if you like what you see, please subscribe and click the link to subscribe to our YouTube page. We appreciate it and look forward to giving you more great content.